Hey guys, Claire Cantor here with Spread the Well, and I wanted to piggyback on the video that we did earlier in the week on the scalene muscles and give you some techniques of how to self-release and basically treat yourself when you feel like you might have a scalene that is acting funky. The important thing to keep in mind when it comes to anything in the cervical spine, if you have been given a set of exercises or stretches by someone, a physician, a PT, it doesn't matter what. And part of those is to stretch a cervical muscle. I would say do not stretch until you first have released the trigger point, the spasm, that sort of thing. The way that our body is designed is that when a muscle is already overprotected, stuck in a state of spasm, with trigger points, and we go and apply a pressure, and that muscle feels like it's getting forced in a certain direction, the rebound effect will be brutal. Okay, so this is why when I was still working in the clinic and I would get a referral that would say, cervical traction, right? I worked in a clinic that had a traction unit. You can do a lot of worsening symptoms and creating more of a problem if you go straight into trying to traction or stretch a muscle that is already too protective, okay? So if you are going to do any cervical stretching of any kind, two things. Number one, you better make sure first you are doing some manipulation, some trigger point releases, anything you have in your toolbox that is going to release that tissue and warm that tissue up. The other thing that I will say is I'm pretty anti pulling on the neck or pulling on the head to get a stretch in the neck. I think that there are plenty of ways to create sort of a pull and counter pull in both of the directions or both of the attachment points of the muscles in the neck where you don't need to overpressure. Of course, if you're someone who has been mobilizing your neck and stretching your neck for years and you understand your body, that's one thing. But if you're coming at this from a new, point. The other thing that I always do is if you are going to be treating and or encouraging a stretch or a mobilization to one side of your neck, I always encourage to do it to the other side. So a neck that is sticky or chirpy or inflamed or aggravated or irritated or whatnot, that is requiring some manual therapy and input, what you don't want to do is go and force the neck into one direction and not the other, okay? So think of it as a balance of forces. You're wanting to balance the system out. So if I'm going to do a gentle scalene stretch on the left side, I'm going to turn around and do it on the right just to keep kind of a balance, even if my left scalene is the one that is more flared up, okay? So let's first talk about just what a scalene stretch looks like. Okay, so the scalenes, we talked about that they are on the side and sort of front of the neck, okay? So to access how to lengthen that muscle, again, I'm jumping ahead, we're gonna do trigger point release first, but just while I was talking about stretching. I'm going to take the 2 points of its attachment, so the first and second rib behind the clavicle and the side of the neck, and we're just going to take those and pull those two places apart, okay? So I'm going to put my left arm behind my back, and that's a way that just kind of decompresses and depresses the scapular complex, including the clavicle, ribs, and all of that stuff. And then sitting nice and tall, I'm going to just side bend my head to the opposite side, okay? So that right there gives me a good stretch. Not only is it stretching the scalenes, it's also getting a little bit of the upper trap and levator. To access a little bit more of the scalenes and specifically the anterior scalene or the one in the front, I can add looking up towards the ceiling, okay? This is also gonna get that sternocleidomastoid. What you should feel when you do this is almost like just the skin feels tight right here across the front, okay? So that is how I would stretch a scalene. If I were going to add any overpressure, again, I'm not doing this. I'm actually going to take my hand and basically connect with the skin and the fascial tissue around my clavicle. Okay, so I'm going to go back to right side bend, looking up towards the ceiling. And then now I'm going to take sort of the skin and tissue around my clavicle, and I'm pulling down on it. Okay, so I'm just adding an element of a little bit of extra overpressure, but in a more gentle, less, forceful way. Okay, so that is a stretch to the scalenes. And again, if I'm doing that, I am definitely going to counter that force and do it on both sides. Okay, now we're not going to do that stretch until we have first released and massaged and warmed those scalenes up. If you are having an active scalene trigger point presentation, meaning you're getting that achy in the chest, you're getting pain down the arm, pain down the back of the arm is generally one of those, or pain in the back of the shoulder blade, do not stretch. Do not do that even after you're warmed or even after you've done trigger point release. A muscle with a trigger point does not want to be stretched. In fact, it will feel much worse, and you can further the referral pain pattern by pushing it. Okay, so we talked a little bit about where the scalenes are. Okay, so just a little recap. And the reason I'm re-showing you this picture, okay, so here's the sternocleidomastoid, that's the sternal branch, that's the clavicular branch, the sternal branch. Right here is where those scalenes are, okay? This is the upper trap. So you've got two muscles that kind of frame those scalenes, the sternocleidomastoid and the upper trap, okay? So to release to access and find the scalenes, we first have to find the sternocleidomastoid because it's bigger, it's more prominent, it's out there, and it's kind of easy to grab onto. Just as a little recap of why you might go to a self-release to the scalenes is if you're having these sort of symptoms, okay? Remember, this is that pain complaint of the achiness into the chest, back of the shoulder blade, down the arm, that does not match any sort of very specific nerve root distribution or peripheral nerve distribution, like a median, nerve pattern and stuff like this. This is way more pain, although sometimes it can present with some paresthesia type thing. And again, recall, because of where they are, when those get super tight, we can get some compression on the brachial plexus, which is the nerves and vessels down into the arm. So, you could feel pain. You could also feel some of these other paresthesia type symptoms. The other thing, and when my scalenes are acting up, or when my first and second rib, I feel a little jammed, I get this like a deep, deep, deep ache in my arm, almost like I can't even really pinpoint where it is, and into my chest. I also feel like that arm feels heavy, or like it's not getting adequate flow, almost like the blood pressure cuff sensation. So that's my personal kind of take of when I need to get into those scalenes. Okay, so finding the sternocleidomastoid, okay, the SCM, it side bends and rotates opposite. Okay, so this left SCM, I am side bending to the left and it pops out a little bit. I can get it to do that even more by rotating. Okay, so now this is the sternocleidomastoid. All right, so I do that side bend rotation to pop it out, and then I can come back to neutral. I've got it in my hands. We know, based on that picture that I just showed you, that the scalenes are almost like directly behind that. Okay, so what I'm doing is I've found sternocleidomastoid. Sometimes you can even go down all the way to sort of the bottom part, the distal part of this SCM, like right behind the clavicle, and you can start there and work yourself up. And I'm giving just a posterior pressure. So I'm not kind of pressing into my neck where some of the vasculature that we kind of, don't want to mess with is there, but I'm just pinning right behind. And then I've got sort of the backdrop is the upper trap and even the levator. Right off the bat, when I poke there, I get that achy there, a little bit of uncomfortable down the arm. And remember, with trigger point releases, the idea is holding sustained pressure, okay? Not aggressive pressure, just that you're in the right spot, a spot that reproduces a familiar sensation and pain. Me just holding that and talking to you and using my arm a little bit, it is already dampening. The key is too, is that in these vulnerable areas, like this is another one is the iliopsoas, is I don't like to just throw my hand in there and put pressure. What we can do is create a quicker release by trying to activate that scalene. Okay, so we know two things that the scalene does is it side flexes the neck. Okay, so that's one thing you can do, is just kind of getting your head moving. The other thing is that it's an accessory breathing muscle. So another thing that you can do, and people like to add eye movements to this, is so you want to take a breath in, and as you breathe in, you can look down. So, and then as you breathe out, look up. Sorry, I'm moving my head. Technically, it's just eye movements. I'm gonna try that again. So, okay, I've got my hand right on my scalenes. So I'm gonna breathe in, looking down, and then breathe out. My eyes go up. Sometimes people teach it the opposite, where you breathe in, look up, breathe down, breathe out, look down, and any of those things are okay. The other thing is that the anterior scalene, if you get a little bit closer to the clavicle, the anterior scalene is kind of right there. Another thing that I will teach, and I'll do it on patients and then show them, is a first and second rib release, where basically you're doing that same thing and finding the scalenes, okay? And instead of pressing just straight back, again, not towards the neck, but I'm gonna kind of press down into the little area. It's a very sensitive area. That's that thoracic outlet. That's a lot of things passing through there. But what I'm gonna do is just find kind of a density under my fingers. That is the first and second rib. Right off the bat, I'm getting that same sort of referred pain pattern. That's a scalene that I've got going. One way we can add an extra bonus to our release is to do just a simple arm elevation, okay? And I'm holding down. So what I'm doing is I am just gently holding pressure behind the clavicle down on that first and second rib while I'm mobilizing my arm, okay? And what we're trying to do is we're trying to disconnect the clavicle from the first and second rib behind it, okay? So this area is so densely fascially bound down in most people, okay? Like the way gravity works, the way our body works is that we're often just pulled forward, okay? So there's a lot of tension through there. I do a lot of work with my wellness clients of just freeing up and teaching them how to free up the upper chest and around the clavicle to really kind of dissociate all of these different structures. The clavicle, we don't really think about this. We think about the shoulder as a ball and socket joint. The shoulder is for a network, kind of a complex or a network of four joints, yes, including the ball and socket, but also including what we call here the AC joint, which is where the clavicle meets the acromion, which is this little bony prominence off the front side of the scapula. The other thing is the sternoclavicular joint right here. That right there is likely the most important aspect of the shoulder because it is what attaches our shoulder to our axial skeleton, to our trunk, okay? So this has to move, right? Yes, it's important how much movement we have at ball and socket, but we also need to have the scapula slide on the thorax. We have to have the AC joint moving, and we certainly have to have the sternoclavicular joint moving as well. If I've got all of this tissue bound down, including the ribs in the back and you know, the scalenes are holding on for dear life and all of that, when I go to elevate my arm, that whole unit is going to move together, and it's going to further the ribs coming up and the jamming of that brachial plexus, okay? So first rib release, finding again sternocleidomastoid, going down, going behind that clavicle, pressing down, and then doing a little arm mobilization. It does not feel comfortable. Always say go as high as you can, to pain but not through pain, right back down. And then you'll do that over and over, and you'll notice your shoulder gets to move a little bit better. I'm running out of time, so hopefully that was helpful, and I'll see you guys next time.